and about the work that we do and about the sort of run-up to the programs that we're going to be demoing for you. And then we'll talk a little bit about how they get implemented and how they're acquired. And finally, what you can do next to try them out in your own context. So first thing I want to talk about is conversations. Conversations are powerful tools to change attitudes and behavior. Whether you're a parent or a coworker or a patient in a doctor's office, there are opportunities all around us to have conversations that shape attitudes and behaviors for better or for worse. And what we're hoping to do at Kognito, what we try to do, is make those better. True human interaction is really on the decline, and any of us who have a child with a cell phone know this better than anyone. I have to say, I will confess to you that I myself was reprimanded on Saturday. Mom, you are always on your phone. So I think everybody needs to take a step back and in some cases really relearn how to have a conversation. And the conversations that we'll be talking about have a lot of importance not only to people's lives but their well-being. So our mission here is really to positively impact millions of lives by revolutionizing the way people learn to navigate challenging conversations so they can become the catalyst for positive behavior change in others. That has a couple of steps to it. And really the reach of millions is not an exaggeration at all. We are leveraging the power of the internet to get really impactful, life-changing behavioral rehearsal into people who can change the way they behave and as a result change the way that people around them behave as well. And this has importance in behavioral health, in chronic disease, social issues, families, everywhere that we are. We have not just come around to doing that. How do we do it? We do it with the Kognito Conversation platform. We've been working for almost a decade to develop and refine this program. We've used it for behavior change in substance abuse, mental health, childhood obesity, and this platform is not only an authoring tool but a delivery engine, making this virtual human role play available to people all over the country and all over the world. So in fact, what we know about role play is really interesting. What we know about role play is that people don't like to do it. But we know that role play is essential to changing behavior. So that brings us to why virtual humans. Why role play with virtual humans? Well, virtual humans have a lot of really great attributes. For one thing, they can be programmed to be expert role play partners. If you've ever done role play with a bad partner, you know that that is a suboptimal experience in terms of your learning. If you are nervous in front of a crowd or in front of a group and you're being asked to not only learn skills but perform and demonstrate those skills at the same time, that's really hard to do, or can be hard to do unless you happen to be a very, very savvy professional actor. So what we hear from people all the time is, I know that role play is the thing we have to do to inculcate these skills, but people don't like to do it. I don't like to do it. My class doesn't like to do it. So we've created a way to do that that provides people with a safe space. Another important thing about virtual humans versus, for example, video characters is a question about transference. When you look at the animated characters that we've developed, they don't remind you of your Uncle Joe or your teacher from 3rd grade, and it's a much simpler interaction. Our whole goal is to keep the learner on task and focused on learning and remove all of the distractions. One thing I like to say about this methodology for learning is that it's very much essentialized, and we can teach people, we can give people skills and information and change attitudes in a very, very short period of time. Some people say, well, I need 6 hours of training. But if I can teach you to do something in an hour, I don't need you to have 6 hours of training. So let's talk a little bit about what we're going to talk about today, which is 2 new programs and where they fit in with some of our previous work. I know a lot of people on the phone have already been exposed to some of our previous work. Here you have a depiction of programs that we first started developing as professional development for educators. The first of these programs came in 2010 with the program for high school educators. But really, you know, we've been in this space a little bit longer than that, and every single program in this that we'll be talking about in the past and today has been a response to the needs from our clients and partners. So we developed the initial simulation for university faculty, and the response was tremendous. We need this for high school. We need this for middle school. We need this for primary care practitioners. We need this for emergency department staff, and on and on. So there's been a lot of purely organic growth in this portfolio, particularly in the element or in the K-12 education space. We started with high school, which begot the middle school program, which people said to us, we really need to be able to reduce bullying in our classrooms and talk to LGBT students. And today we're putting the 3rd leg of the stool into mental health programming with at-risk for elementary school educators as a professional development tool, and a brand new tool for, and our first foray into training for high school students, which is a program, a peer support program called Friend to Friend. So we're so excited about this. We had a lot of fun developing it. Again, it's the first program that we've developed for this age group, but it's based on earlier work in a peer training that we did for college students, which is on the National Registry of Evidence-Based Programs and Practices, called At Risk for College Students. And this one is geared to high school students. It was developed with input from adolescent psychiatrists, school mental health professionals, educators, and of course students themselves, who had a lot to say about this program and were some of the most influential people in helping us shape this program. It somehow seems appropriate to let kids tell you what kids want. And so let's jump right in, because I know the most fun part of this webinar is going to be seeing how the program works. And so I will introduce you now to Michael and Anna, who are going to lead you through this simulation.
Hey guys, I'm Michael, and this is my friend Anna.
Hey.
We're seniors at Central High, and we made this so you can learn some ways to help friends who are going through a hard time.
Because we've both been there. You want to talk about what you went through?
Yeah. I didn't like talking about it at first, but it's gotten a lot easier. So back when I first made the soccer team, we were like practicing every day. Plus, money was pretty tight at home, so I got this part-time job at a pet store. Between all that and school, it was a lot. So then one day before a soccer game, I suddenly got really dizzy, like I was going to puke or something, and I felt like I couldn't even breathe. And that happened a couple of times.
Then he talked to his coach about it.
Yeah, my coach noticed something was up, and he asked if everything was okay. I told him I didn't know what was going on because, I wasn't sick. And he said it's not just about how healthy your body is that makes you feel good or bad. It's also about how healthy your mind is, how you're doing emotionally and socially.
Your mental health.
Right. Your mental health affects your physical health. Like sometimes when you're sad or down, you feel tired or don't have energy to do things. It affects a lot of other things too. How you think, work, cope with stress, make choices, act with people.
Just like how everyone gets sick or injured at some point, everyone deals with a mental health issue at some point too. Sometimes it's caused by big things, like someone in your family might die or you might break up with someone. Other times, it could be a bunch of little things that build up. And even other times, there might be no obvious reason at all. I mean, sometimes people just get sick, even though they take care of themselves really well. It's the same with mental health.
Whatever it is, it doesn't mean you're crazy or weak or less smart. And just like how there are ways to feel better when you have a physical problem, like medicine or physical therapy, there are ways to improve your mental health too.
Yeah, you can talk to friends or people who care about you, learn ways to keep yourself calm, maybe even talk to a doctor or counselor. Sometimes it's easy to feel better again, and other times it takes a while.
What happened with me was that I was under so much stress that it was making me feel really anxious and panicky. My coach suggested I talk to the counselor at school about it.
Were you into that?
Not at first, but I gave it a try. The counselor helped me think of ways to cut down my stress, and she didn't judge me or anything. She just sort of let me talk it through.
So Michael had that happen our sophomore year. Now, flash forward to about 6 months ago. That's when something similar happened with me, and I went through a hard time. But Michael was a really good friend. He stuck with me and helped me talk it out, and that's what inspired us to make this. In case anyone else out there is feeling stressed or sad or whatever and doesn't know what to do, or if you have a friend who's feeling that way and you want to help. We'll also talk about what you should do if you're worried that a friend might hurt themselves.
It's definitely not your responsibility to solve all your friends' problems, but if you notice that a friend is acting different, or you have a feeling in your gut that something just isn't right with them, it's cool to check in, talk to them about it, and help them get some support.
You can connect them with someone who can help, or tell an adult you trust that you're concerned about your friend.
Anna and I made a simulation.
Based on a conversation we had a few months ago. Things at home had really fallen apart, and I was sort of a mess. Snapping at everybody, not answering anyone's texts, posting sad song lyrics all over the internet. It was, yeah.
In the simulation, you'll play my part, and you'll talk to Anna. You want to see if you can help her open up about what's going on, try to understand what she's going through, and connect her with someone who can help.
Okay, so you've seen a little bit of the intro here, and Michael's talking about what your goals are in the simulation. So let's jump forward into that simulation. And
Here we are.
whoops, there you go.
After school one day. I figured this would be a good time to talk since it was quiet and no one was around to eavesdrop or interrupt us.
Hey, wait, you look taller here. How did you do that?
Anyway, we've got a few hints on how to do really well in this simulation. To achieve your goals, you need to do 4 things.
Number 1, ask questions, especially open-ended questions that need more than a yes or no response. This is the best way to understand what I'm going through and make me feel like you care.
okay, so now we're going to talk to Anna. And okay, so we're ready to talk to Anna. And first, we're going to focus on goal number 1. We need to help Anna open up. So let's take a look at that. Oops. Okay, so as you see, our goals are listed down here at the bottom of the screen, and those are the 3 things we're trying to achieve in this. Here you have a score, which is a new feature in this game and one that we chose, scoring and badging, particularly as an engagement strategy with young people. And when we tested this on young users, they were very, very excited about this feature. And over here, you're able to navigate your choices of how to pursue this conversation with Anna and to meet your goals. So as you can see, you can either choose to make an observation, and then you have 3 options of how to do that. You could say, you look really, really tired lately. You haven't been hanging out as much. What's going on? Or you snapped Robbie's head off in the cafeteria. Or you can decide to get some more information. What do you mean Robbie doesn't get it? Or something's up. You've got to tell me what's going on. So it's your turn to make a choice. And let's see what happens when we make an observation. And let's find out what happens if we talk about snapping Robbie's head off.
You totally snapped Robbie's head off.
Excuse me?
You really unleashed your inner demon. We were like, does this girl need an exorcism?
Wow. Thanks, Michael. Is that what you guys think of me? That's great. Just what I need right now.
Hey, I'm sorry. Okay, bad joke. I just meant it's not like you to be like that.
Well, sorry. I'm just really stressed out.
Okay, so that was probably not the best choice we could have made. Anna is pretty visibly upset. She's giving you feedback. Obviously, she's giving you an immediate feedback with her tone of voice, the words she's chosen to say, her emotional response. But you're also getting feedback from the expert system. So this feedback says, criticized. You sounded critical, so Anna got defensive. Be careful about making jokes in sensitive situations. It might feel like you're making fun of the person and you've lost points. You can see now we have another feature that's popped up here, which is Anna's thoughts. So we get a chance to start helping you increase your emotional intelligence, not only by showing you what kind of a negative response you have generated from Anna, but also what's going on in her head. So let's take a look at that.
Did I really sound that bad? Even if I did, I don't need to hear it from you. Just be my friend. Don't get on my case.
Okay, so you can see that your choices have changed over here, but you have the opportunity to undo or replay what just happened. So if somebody came into your office and asked you a question and you didn't even hear what happened, you could replay that choice. Or you could say, oh, let's see if there's something I could have done differently and make a different choice. Let's see what happens here.
It seems like you haven't been able to hang out very much the past couple weeks. What's been going on?
I know. Things are kind of intense at home again. So I always have to help out. This is literally the one afternoon I had free.
What do you mean? What's up?
Just my older sister being awful, being herself, and everyone else just has to deal with it.
She's acting up again?
Yeah, she's like drinking too much all the time or coming home high. My parents are screaming at her, she's screaming at them, and I have to take care of my little sisters and try to keep them from hearing all the screaming.
Okay, so now you can see that we have first of all, a very, very different Anna than the Anna who got defensive and critical. You've asked a good question. You've helped her open up, which was your goal. You have also gained some extra points here, 200 for asking her what's been going on and encouraging her to open up, and another couple 100 points because you stuck to the facts. You asked her that question in a non-judgmental way. You haven't been hanging out with us as much. You haven't been hanging out with us as much instead of where have you been, you know. So I think we can leave the simulation here. You get a chance to see how it works, and I would encourage you to ask us for a link so that you can complete this if you'd like to do that. So let's go back and look at the learning objectives for this particular program. First, to increase awareness of mental wellness and signs that appear might be suffering from psychological distress, including thoughts of suicide, and the suicidal content comes a little bit deeper in the conversation. To learn best practices for approaching friends who might be suffering. So not only are you learning awareness, but how to have that conversation. Third, to decrease stigma and correct misconceptions surrounding mental health disorders. It's okay, not only okay to ask, but these are normal events in people's lives. And fourth, increase awareness of support and resources available to students both locally and nationally. And that you don't see in the simulation interface, but there are local and national resources offered to you from within the interface itself. There's a toolkit at the end of the program. You can also print a summary of what you've learned. You can learn about resources. If you're a client of ours at the state or district level, we can input your local resources information to the system so that students have those available to them. It's really a very, also suicide prevention lifelines and other national resources are in there too. So we hope we get those resources in front of a lot of people who can benefit from them. So one question that often comes up is, oh, that's a really neat thing, but what do I do with it in my school? This has been designed for use in health classes, language arts, English as a second language, biology or life sciences where we might be learning about mental health. It could be something that you do either alone or as a group in an advisory or homeroom or as a club activity. The first adopter for this program is the state of California. The California Department of Education and the Placer County Office of Education are disseminating this statewide and have developed health and language arts curriculum to meet core curriculum standards, as well as more limited lesson plans utilizing this content. There's also a group of NAMI on-campus school clubs that are using it as an activity for the club, pushing into class, educating peers as part of their club activity. Next, I want to talk a little bit about at-risk for elementary school. I'm not going to demo that for you. I know a lot of the people on this call today have already experienced some of the other educator professional development courses, and this would be somewhat similar. Again, you're welcome to request a link so that you can go through this program. In the case of at-risk for elementary school educators, again, we're trying to raise awareness of mental health and mental disorders and how they relate to learning behavior, get educators who are on the front lines with students every day to recognize warning signs that a student might be experiencing psychological distress, build skills and confidence for approaching students, and this is important, and their parents to discuss concerns and to problem solve. So this is the first time we have modeled a conversation with a parent in this series, although we've done it in several other programs before. But that's a question that comes up often is, how do I talk to parents about my concerns without seeming to overreach? And fourth, to avoid the common pitfalls such as diagnosing, judging, or giving unwarranted advice. For those of you who are familiar with the predecessor programs for high school and middle school educators, one of the things that's always important for us is the context of the learning is relevant to the learner. Kids in high school present a little bit differently than kids in middle school. Their concerns are different. Common situations are a little bit different. So in high school, we have a girl who is worried about her grades, about getting into the college of her choice. She's anxious, and we come to find out that she may be cutting. Or a boy who's missing a lot of school and may be involved in substance use, or a shy boy who's written about suicidal thoughts in an essay. In middle school, where bullying is a big problem, two of the scenarios deal with bullying, both the victim of that bullying and the ringleader of the clique that's been excluding her. And in the new program for elementary school educators, we have a scenario with a third grader who's become withdrawn and whose family has experienced some trauma, and a conversation with the mother of a fifth grader who has become increasingly disruptive in class. So each one is really tailored carefully to the user group that will be using it. And where does this fit? You know, how, if you are a school leader or a district level professional or even a state level person involved in mental health or education, where does this professional development opportunity fit? We have seen people very successfully implement this as part of in-service training, required professional development hours. Some people swap it for a weekly staff meeting. It takes about 45 minutes to an hour to complete, so that's easy. It can fit in a couple of prep periods. It can be a standalone program, or it can be paired with discussion. So often in an in-service setting, you would have people spend an hour taking the training, and then they would come together in a group setting to talk about the local information. What are our local school policies and procedures? Who would I go to? How are we organized to serve kids in distress? What is the referral process here? And the why of this is, in some cases, in some states, there's a mental health training legislation that's been adopted that this program can help you address. In Texas, there's HB 460. In Washington, D.C., there's the South Capitol Street Memorial Act. There is, in many states, I think going on 12 or 15, the Jason Flatt Act, suicide prevention requirements or mandates for educators. And I would say that in the case of the Jason Flatt Act, there's a whole range of variability in terms of how much training is required and how often. I think at the lowest level it doesn't specify, and at the highest level we've seen 8 hours every few years. Our programs can be used to address that whole range, and if you're interested in how to do that, you can contact me. And also, it's very well utilized in school-wide initiatives. If you're looking to improve school climate or to address bullying or to make your school more welcoming in terms of diversity, or we've had people tell us we've used it for ethics, substance abuse, or suicide prevention programming, all of the above. I remember early on a teacher in New York, a principal in New York City said, I adopted your program because I was hearing complaints from parents about the way my teachers were communicating with the students. She said this was very helpful. So one of the things that's really, I think, important about these trainings is that they are designed for the people who are using them, and they are designed for a range of issues around psychological distress, but the communication skills that you learn can be utilized the moment you close the program, so that you are practicing those skills from the beginning. And I think that's another reason why they stick very well. And our research shows at 3-month follow-up that people really have changed their behaviors in terms of referring, identify, approaching, and referring students in distress. As I said, the growth of our portfolio of these programs has been organic. So this is really an approach to learning that has resonated with many, many agencies. Our programs have been adopted by state and federal agencies and over 600 institutions of higher education. We are providing training, for example, to I think at this point it's 102 out of 112 of the California community colleges. That's the largest education system in the country. Also to the largest school district in the country, which is the New York City public schools. where we have deployed our high school and middle school programs as well as our Step In Speak Up LGBT program. Over 40% of U.S. secondary schools have sponsored access, aka free access, to Kognito simulations right now, from Alaska to Hawaii to California to Oregon over to Maryland, New York City, Fairfax, Virginia, Delaware, and lots of states in between. Folks are using this training. And we are very careful to make sure that when we're developing the training that it works across socioeconomic lines, geographic lines, racial and ethnic lines. In fact, we recently wrote and are just about to publish an article about use of our trainings by American Indian and Alaska Native users. And in every case we've looked at, the training is equally effective across those kind of boundaries. So 3 of our programs are in the National Registry of Evidence-Based Programs and Practices. Over a dozen, and I've lost count at this point, are in the Suicide Prevention Resource Center's Best Practices Registry, which enables people who are have to choose programs off of those 2 registries to use our program. We're often asked about funding sources. The ROI on these programs is very, very high. And I would say that if you don't have general funds to purchase programs, there's lots of other places to go. We have states that have purchased training using their SAPT block grant dollars. That's the Substance Abuse Prevention Block Grant, Title V, Safe and Supportive Schools, SAMHSA's Garrett Lee Smith State and Tribal Youth Suicide Prevention Cooperative Agreement, as well as legislative line items and other programs that states have developed themselves, like in California, the CalMesa California Mental Health Services Act. Schools and districts, you can use general funds. Sometimes there are mental health mini-grants. Even a PTA can sponsor a program like this. There are local foundation grants, safe and supportive schools at the local level, safe and drug-free schools at the local level. If you have a good bake sale, you can afford one of these programs in your school. And then in terms of what's next, I would be very happy to have you evaluate the full versions of these programs. You can just email me. My email is here at the bottom of the screen. For the elementary school program, this program is already available in Maryland, the District of Columbia, Hawaii, and Nebraska. If you are in a school, I'm happy to send you an individual link for evaluation. If you're in a district, you can train up to 15 individuals. If you're in a very large district that looks more like a state, you could train up to 5 schools or 200 users. So just contact me and we'll work out the details of that. With Friend to Friend, the peer support training, that program is already available at no cost across California. And for anybody else who wants to request review links for that, please do contact me. And I would love now to get to your questions, and I saw a few come in. You're welcome to continue asking questions, and let's see what we've got here. Take me a second just to get these popped up on the screen. A lot of discussion about CEUs for the webinar. Like I said, we don't have CEUs cleared for the webinar ahead of time, but we can provide you with confirmation of your attendance. We are recording the webinar, and we will be happy to send out that recording for you to share with others. And yes, tracking and data collection about users. We do have a very robust reporting system with this program. If you are in a school, we track your users, who's used it, who's launched the training, who's completed it, and the dates for that. If you're in a district, we can input all of your schools, so you can look at a school-to-school comparison and see which of your schools have had high penetration or have used the training on any or all of their educators. At the state level, we can cut that data by school, by county, or by district, even in some cases by congressional district, which is sometimes comes up. So it's very easy. You get a very robust kind of user tracking and reporting, which is very important if you are using grant funding. If you're using Garrett Lee Smith funding, we have a special report that works with the cross-site evaluation requirements. So we can provide you with that, which really reduces the reporting burden. In addition, users take a pre-post and follow-up survey so that we can also provide you with survey data to measure and assess learning outcomes. Okay, let's see, what other questions do we have here? What states already have Kognito programs? I wish I had my map here, which I don't, but I can tell you, in addition to this, to the Maryland, DC, Hawaii, and Nebraska, K-12 programs are running in California, Arizona, New Mexico, Texas, which has trained over 30,000 teachers, Illinois, Iowa, Ohio, I'm missing a few, Delaware, Massachusetts, Maryland, Fairfax County, Virginia, and hopefully many, many more in the days and weeks to come. Again, Friend to Friend, this is a brand new program, and we're very eager to see how that works for people. As I said, we have lesson plans that we can share with you, and all of these programs come with outreach materials to make them really easy to use and turnkey to get them into your schools. So I think that is about all that I have to say at the moment, and I really encourage you to get in touch with me and to take a look at these programs and to consider how they might benefit you in your setting. And that's a wrap. Thanks so much for your time.